All right. Well, welcome everyone. Welcome everyone to the 2017 CNS Food for Health workshop. And I wanted to also thank ILSI North America for their contributions and partnership in the organization of today's activities. The Food for Health workshop would not have been possible without the tremendous efforts of the organizing committee. So I just wanted to recognize Drs. Leah Gramlich, Robert Bertolo, James House, Andrew Grantham, our Executive Director, Eric Hingis, Ashley Wiggins, and Heather Steele. We've put together a really excellent program that builds on many years of activities. And it's born out of the advocacy work of the Canadian Nutrition Society, whose mandate has been to raise awareness, facilitate connectivity, be a catalyst for change, and working towards developing solutions to improve the health of Canadians and citizens globally. Just a little bit of a historical perspective to put today's workshop activities in context. Our first Food for Health workshop was actually in Guelph back in 2011. And that very first workshop was really a survey scan of all the challenges that span the long, rather large continuum of agriculture to food, nutrition, and health in the health sector. And born out of that initial workshop has been successive workshops really tackling the issues that were identified in that very first one in Guelph. And we've covered topics ranging from conflict of interest to communication. And then starting in 2014, we really got engaged working with ILSI North America, where we've developed a number of workshops over the last several years. In 2014, we worked on principles and philosophies on developing public-private partnerships. 2015, a continuation of that, addressing the knowledge translation aspect and educating consumers and stakeholders. 2016, a much more broader perspective, looking at global perspectives related to research and public-private partnerships. If I can sum up the range of activities to date, we've really been looking at very broad, 10,000 feet issues related to the generation of knowledge. How do we move knowledge to the consumer? A really push perspective in terms of activities, generating knowledge and moving it forward. And over that period of time, I think we've had a growing recognition that there needs to be both a push and a pull perspective. Many of us in the audience are involved in activities that relate to generation of knowledge and pushing that knowledge out. But what's very important is that we have to recognize, and I've used this slide a few times now, in Canada, there are, and I really love this, this quotation, which came out of an earlier workshop, where there are 30 million nutrition experts in Canada. And they're willing to argue with me on a topic about which I am a world expert. And that's, I think, very impactful in terms of our discussion today, because we have to recognize that it's the experts, the 30 million experts in Canada, who are going to assess knowledge, and it's this pull perspective that we also have to consider, in that we're pushing a lot of information to them, but there has to be an uptake and a pull for that information, and that's really at the level of the individual expert. So we've tried to preface the workshop by sending out a survey and really getting a handle in terms of, or some feedback, initial feedback, to help guide us in terms of the workshop and our discussion today. So I'm going to share with you some of the findings, the broader view findings of our survey results. And there's a couple of definitions that I just wanted to share with you, and I just did a quick Google search around behavioral economics and cost-benefit analysis that relates to our workshop today. So behavioral economics explains why we procrastinate, we buy, borrow, and grab a chocolate on the spur of a moment. So that is, I think, a really nice quote that highlights what behavioral economics is about. And we'll learn more from the experts in today's workshop. And through behavioral economics, there's also a need to understand cost-benefit. And traditionally, it assumes that individuals act rationally and are primarily motivated by self-interest. And I think that's, this statement is true for a very select few when we think about it, because we don't always make rational decisions. And that's been, I think, a founding assumption today, because now thinking has evolved to reflect behavioral economics, which explores the psychology and the aspect of decision making. So that's why these two concepts are related. Okay, so before we get to the survey results, we asked some general questions on our survey around barriers to consumer uptake of nutrition advice and consumption of healthy foods. 47% of respondents of the survey indicated that nutrition literacy is a barrier. Lack of trust, about a quarter thought it was significant. Poor understanding of food labels, health claims, about 50%, and 59% viewed high food costs as potential barriers for the uptake of nutrition advice and consumption of healthy foods. We also asked people for their opinion as to other barriers, and there was one quote I just want to highlight. There's a willingness to accept rhetoric, false news, and fake news is another way to describe this that's been in the popular press. And so again, I think it highlights the importance of recognizing the individual in terms of how they perceive information, where do they get information, and changes in their behavior. Okay, so some of these survey results. To what extent are you familiar with behavioral economics or nudge theory? The vast majority of respondents indicated 65% very lack of knowledge around behavioral economics. And of those that have used behavioral economics in their activities, 80% said they're aware of it but haven't really applied it in their daily activities. To what extent are you familiar with cost-benefit analysis? There's 62% responded that they have good working knowledge, but again, the vast majority have not utilized cost-benefit analysis in their work. And about a third and a quarter responded that they indicated that behavioral economics, nudge theory, cost-benefit analysis was important in their broader workplace. Okay, so the objectives for today are to illustrate examples of economic analysis in nutrition, agriculture, and health research, really representing the span of food for health. Explore opportunities on transferring food and agriculture knowledge into health policy intervention via behavioral economics and cost-benefit analysis. Examine various pulls and pushes that influence decisions, and discuss opportunities and limitations of economic approaches. So those are the broad objectives for today, and if we were to just simplify it, we're here to learn, to be engaged, to network, and enjoy each other's companies, as I see many familiar faces in the audience. And now next on my to-do list, are probably the most important things, I have to remind everyone that the break is going to just be down the hall where there'll be coffee. Just where you collect your registration materials. There is internet available, and you can sign on and look for the CNS SCN 2017, and the password is nutrition, capital N, as the password, so if you want to connect through the Wi-Fi. Lunch will be upstairs, where we had breakfast, so just up the escalator and to the right. And so that leads me to introducing our first speaker. And actually, I actually forgot to introduce myself. So But there's so many familiar faces in the room as well. So my name is David Ma, for those that don't know me. Each year I introduce myself and I seem to have a different title. And this year my new title is President. So I welcome you as the President of the Society. I want to wish you a wonderful workshop today and a wonderful conference over the course of the next few days as well. So our first speaker is Dr. Richard Williams. He's an economic consultant and senior affiliated scholar, Richard Williams Consulting and at the Mercatus Center at George Mason University. He's been working in this area for over 35 years, a wealth of knowledge and expertise, and we're very glad to have him here. He's had experience working with the US FDA, and he's a sought-after speaker and expert in economics globally. So we're very much excited to hear about your talk today, and please welcome Dr. Richard Williams.